It is great to be here with everyone. Today, I am hoping to answer some of the top questions that you might have or update some of the information that you might have in your mind about COVID. Our loose agenda today will be to hit on some of the key questions right now, and those are masks, tests, quarantines, vaccines, risk factors, Omicron, kind of the state of affairs where we are right now with the Omicron surge. I wanted to then transition a little bit and talk about decision making in public health, because there's a lot of questions about why certain decisions get made, how they get made, and I think that might make a nice conversation for us to think about decision making a little bit in the context of COVID-19. So starting off, let's talk a little bit about masks. Many of us throughout the pandemic have been using barrier face coverings. So those are the cloth masks, which may have 1, 2, or 3 layers of protection. Some of those have a filter insert in them. Some of them may have a filter that stretches throughout the full mask. The primary function of barrier face coverings are to provide some source control, i.e., it keeps you from spraying your respiratory droplets everywhere. And it allows for partial particulate filtration. So it's reducing the amount of particulates in the air that can access your respiratory system. So those barrier face coverings are kind of providing some filtration on both ends, both protecting you from stuff coming in, as well as you spreading respiratory droplets and things out to others. That is so that's sort of that's one level of face covering that exists. The next level are the surgical face masks. Those are comprised of 3 layers, and there's particular materials that are used. Those vary slightly depending on the manufacturer, the country of origin, and so forth. But usually, it's a piece of filter paper that has been heat treated, and it is specially designed. The fibers within that are specially designed to be able to collect particulates from the air, and also to absorb and retain fluids in a specific way. So what that does is it allows an increased amount of source control and particulate filtration over the face coverings, the cloth masks. So it increases the capabilities of doing both of those things. And it also provides a fluid barrier. And what that does is it prevents large particle splashes like spit or other fluid splashes, saliva, respiratory secretions, and so forth. Throughout much of the pandemic, that has been enough. That's been a good amount of protection, because a lot of the viral particles that we may have deep in our lungs, in order to transmit them, typically those, even though they're very, very, very tiny, they gather together in droplets of moisture and mucus that we might secrete as we're talking, breathing, sneezing, coughing, and so forth. And so what was found early on in the pandemic, back in like the spring, summer of 2020, is that a lot of those viral transmissions were being gathered by absorption of the fluids and fluid particulates. So that's why those masks were considered to be good and fine for helping to slow and prevent the transmission. Now, throughout the whole pandemic, and including now, we have known that N95 masks, or respirators, as they're often called, are the best. However, those were not necessarily recommended until more recently. what's happened is that the Omicron variant of COVID-19 is so much more transmissible. It takes less of the virus to get into your respiratory system in order for you to become infected from it. So because it takes less, then we need to filter out more of the viral particulates that are out in the air. So what that means is that these N95, KN95, KF94 masks, these high filtration masks, what they do is they fit much tighter around your face. They have a better seal with your face. You don't have the gapping that you typically do with a surgical mask and with many face coverings. But you have that tighter fit. But the 5 layers of filtration that are in those high filtration masks will absorb and filter actually airborne particles. So they're actually able to filter out bacteria, viruses, and other particles in the air, as well as filtering those respiratory secretions and so forth. So they're a much better mask, and that's why they're important. It's a little confusing, the naming, the N95, KN95, KF94. What's the difference between them? That has a lot to do with the regulatory agencies in other countries. The United States has only one agency that regulates masks, and that's NIOSH, the National Institute of Occupational Safety and Health. I think I've got that right. But whereas several other countries around the world, they have more regulations on face masks and face coverings. So they have that's where the KN95 and KF94, those are coming from regulatory agencies that are actually a little bit more stringent than the ones that we have here in the US. And so these are very, very highly effective masks that exist. So that's just a rundown of what those masks are, why the guidance has changed a little bit more recently, and an urge to go ahead and be wearing the most effective filtration system that you can. This graph came out, this is actually data that was published almost a year ago, but was recently republished and has gotten a little bit of attention, and perhaps you may have seen it out in some of the news media. And what we're looking at here is a graph that is looking at if you, someone who's not infected with COVID, are wearing a mask. Here's the different kinds of masks that you might wear, from nothing to the N95. And the person that you come in contact with who is infected with the virus, how long does it take to transmit an infectious dose of COVID-19? And what we're looking at is that you can sort of draw a line over in these columns and rows and better understand if someone who is COVID infected and they're not wearing a mask, then how long can I be around that person with which kind of mask before I have received an infectious agent? Now, what some of the caveats on this graph are that it means a very tightly sealed N95, which is, which not everybody has the perfect fit on those. And they also expect the Omicron variant to spread much more easily than the variant that was prevalent when the study was first done. But it gives us a little bit of an understanding of why it's important for us to be wearing masks whether we're infected or not, because it's protecting us and it's protecting others. We have a recent publication on our blog at the Science Museum of Virginia, talking a little bit about masks. We have there's a Question Your World audio file, a couple of minutes overview that you can listen to, as well as the blog that you can read, talking about some of this information on the masks. And throughout the presentation today, I'm going to try to point you to our some of the sources that we have on our social media and our blog and our website. We've been trying to serve as a source for you, for our audience throughout the pandemic, and we'll continue to do so. Our next topic to talk a little bit about is tests. There's a lot of confusion about when to test, what kinds of tests to use, how frequently, and what those variations are. The Virginia Department of Health has they have great guidances, as well as the CDC has great guidance as well. This is a VDH guidance that was updated in December. I didn't see a more updated one, but there might be a more updated version of this. As a reminder, science is a constant evolution of discovery. We are learning more all the time. This is the most phenomenal moment in scientific history, where we are getting to implement things and learn things in real time. But what that means is that science is updating quickly, and so we're constantly learning new things. If you're exposed to a close contact and you have no symptoms, then it is a good idea to go ahead and test if you're not vaccinated. If you are vaccinated, go ahead and wait that 5 to 7 days. If you have ongoing exposures, for example, a household member that you are not able to quarantine away from, then there's a couple of different pieces of guidance, to go ahead and test as soon as you have that exposure, as well as a little bit later in the process. That guidance differs slightly if you're vaccinated, where you don't need to have immediate testing, but can wait a little while longer. Any exposure, and also if you have any symptoms, it's a good idea to go ahead and test. These are so those are some of the guidance that exists right now, and we'll go over this a little bit in a slightly different way on a different infographic that I found that I think is kind of helpful, where we'll be talking about that in a minute. This graph I really appreciate, and we shared it recently on one of our in one of our blogs. It's a reshare from another source. But it looks a little bit at the difference between the lateral flow tests, which are also known as the antigen test, and those are the home kits that we have. Before the infectious period, then you can be positive by the PCR. PCR is the laboratory test that you're going to go to a medical health professional and have that PCR test. That is detectable several days, a day or two before detection of the home test, and several days after the lateral flow or the home test, that you would be able to see that. So the PCR is going to detect a smaller amount of viral load in your system, whether that's by the nasal swab or the throat swab or combination. Which is all of the things that are happening. It's very possible to have, and in fact likely to receive, negative results within the first few days since exposure to the virus. That is true. It was true for earlier variants, and it is continuing to be true for Omicron. It looks like the newest data that I just saw, a new article out this morning, roughly 3 days after exposure, then the detection begins on average for the infectious period to begin. that's down slightly from 4 days for the earlier variants. It seems Omicron can move a little bit faster through our systems. However, we do remain infectious for up to 10 to 14 days. So while the peak infectious period will pass relatively quickly, it is a good idea to quarantine as long as you possibly can, given all of the other things going on in your life. That if you're able to extend a quarantine, it's good because that you can continue to have some infectious load. That's a really difficult thing to process and deal with. And so I wanted to hit on this quarantine question quickly. I found this great graphic that was shared on an epidemiologist site that I follow. And this is a graphic that was developed by the Maine Center for Disease Control and Prevention. And so what happens if you test positive? Whether or not you're vaccinated, stay home for 5 days. If you have no symptoms or your symptoms are resolving, then, and including no fever and so forth, then continue to wear the mask when you're around others for 5 days. So it is important to continue to act even as you re-enter the world, going to the grocery store, going to work, whatever the things are that are necessary to do. It is strongly advised for you to behave as though you are still infectious, because most of the studies are showing that there are still infectious agents for many people beyond that time point. So go ahead and continue to wear a mask and be really good about masking around everyone. You can take an antigen test and if positive, need to isolate for continued 5 days. That's another alternate situation. If you have worsening or persistent symptoms during that 5 days, need to continue to isolate and until you have no symptoms or until your symptoms are resolving, at least 24 hours after that fever resolves, without the use of medications like Tylenol or Advil, something like that would reduce your fever. You need to be off of those medications and resolve that fever before you can go ahead and move on into that next phase of being around others, so that you cannot infect others. So I found this to be a really helpful infographic that sort of takes people step by step through the guidance. I've seen the guidance in sort of bullet points and in some other graphs, but I found this to be a pretty helpful flow chart. The same source, the Maine Center for Disease Control and Prevention, also created an infographic in case you have had a close contact. So if you have a close contact of someone who's tested positive, what do you do? Well, if you're fully vaccinated and boosted and have no symptoms, then go ahead. You don't have to quarantine. And it is advised that you test on day 5 after exposure to make sure that you didn't get infected at that thing. If you have any symptoms, it is important to go ahead and stay home, isolate, get tested during that period of time. If you have been vaccinated but not boosted, then that modifies the scenario a little bit. If you've completed it within the last 6 months or 2 months, you might need to quarantine. So if you haven't, and so being boosted is going to help you be able to make sure you don't have to quarantine. So if you're not boosted, then probably going to need to go ahead and quarantine. because of that close contact. And if you are partially vaccinated or unvaccinated, again, going to need to quarantine following that close contact. So those are some of the guidance that are out there for quarantining, and I think that's really great. We our team at the Science Museum, we just posted about what to do when you after you take a COVID test, and that's available for you guys to refer to on our website. I'm going to shift over to vaccines. Jim, I will pause for a minute, see if there's questions about tests.
Okay, Dr. Franssen, we do have a couple of questions. If we could just circle back to masks real quick. How long can you wear a mask before you have to change it?
Oh, that's a really good question. The latest study on like the N95, KN95s are that most of those products are rated for about 40 hours. So you may be able to, you might budget yourself 2 of those masks per week. Now that's going to change a little bit depending on how much you, if they get soiled. If you sneeze and cough or you get something on it, for children, you might want to increase that number a little bit because they tend to be just disgusting. And so I say that having 2 of my own, and they tend to soil their masks easily. A surgical face mask or is meant to be worn once. Those are daily use or less. So you would budget. So if you're using a surgical face mask, a paper mask, then you don't want to do that, just 1 per day and throw it away. And you may need 2 per day if you happen to, if you've got a runny nose that day or are breathing a lot of moisture. The barrier face coverings, cloth face masks, and so forth, you're going to want to wash those on a daily basis, again, to help prevent there to be things. Yeah, it's a great question. Although I will say that one thing that people are doing right now, which has a high efficacy, is they're using a combination of a surgical face mask and a cloth mask over top to help it fit better. That has a very good efficacy and is a great alternative for people who can't get their hands on an N95 right now. So I do recommend that. And in that case, your cloth mask, you might be able to wear a couple of days, while you're changing out the surgical face mask underneath.
Okay, and I wonder if you have any information on how the effectiveness of masks is affected by people with facial hair.
Yeah, it is affected. People with facial hair, they're not going to get as tight a fit around their face, so they will, and that's been known for years, for decades, about N95s, is that facial hair, you can't quite get the seal that you would need to be able to have that. Does that mean that person needs to to shave or to switch into a goatee or something? That depends on how extreme someone wants to be, but it will certainly affect individuals. I have seen some individuals with come up with some creative solutions. I don't know how effective they all are in terms of putting on a surgical face mask and then a larger, like a cloth face mask that covers a larger portion of their face to help it seal better. Again, I can't speak to the exact efficacy of how good that is, but that might be a good option.
So we had a question here about antibody tests. So do you have any data on how the antibody test can distinguish between a previous COVID infection and a vaccination?
Right now, that kind of testing that has the capacity to tell between an earlier vaccination or an earlier infection, that's not done routinely. There are very few labs that are actually running that kind of work. That's more research kinds of work or specific kinds of work that's being done. And I mean, so that the capacity is there, but that's not a routine test at all. I imagine at some point in the future it will be, but we're not there at this moment. But I like that. I'm writing that down because I wanna look up more on that.
All right. Thanks, Dr. Franssen. That's all we've got for right now.
All right. So we talked through quarantines, and let's talk just a little bit about vaccines. Vaccines prevent infection. At this point, we have a lot of data that is coming in from all over the world. This is a piece, you see the one with the sort of orange peach background. That's one that we shared on our Instagram the other day, which is a modification of this piece of information from the Virginia Department of Health. And what we're looking at is the fact that those who are unvaccinated are developing COVID-19 at a rate of about 4.3 times that of vaccinated people. That is increasing, in particular right now with the Omicron variant. I think because it's just so prevalent that we're seeing that a really humongous difference between the vaccinated and the unvaccinated. And so that's a striking difference. There have been studies throughout the last year that have looked at what the effects of the vaccines are on hospitalizations and death. And what we see is that those who are fully vaccinated have fewer hospitalizations and fewer deaths. This study that I'm showing you here was done back in July. There was a number of really great pieces that were done last summer in July and August, kind of getting a state of how things were going. And then of course Delta came along and changed some of the numbers, and Omicron is changing the numbers again. What we're seeing is that is increasingly different. What we see is it's actually more and more of the not fully vaccinated individuals who are being adversely affected by COVID. There was a piece in the New York Times published last week that included these graphs that really showed a huge difference between the vaccinated and unvaccinated. This is a piece that was developed for for Nebraska Department of Health, and they were looking. Every state in the nation is doing these kinds of studies, developing these data and keeping track. Different states are collecting that in different formats, so we don't have all of the U.S. compiled right now in really clear ways, but it's coming, and we do have them state by state. What's interesting, is seeing this also in other parts of the world. So here is a piece from Great Britain, looking at the differences between the unvaccinated and then those who are double vaxxed and those who are boosted. And there's a huge difference in the critical care admissions. So those that are admitted for critical care in the hospitals in those regions are predominantly the unvaccinated. And further, and here's another one. This was done in Switzerland. The same data is being seen. We're seeing that, like I said, this is worldwide in every country and every state that that scientists have been reviewing this. We're seeing this distinction, and that the distinction is getting larger with the new variants between the vaccinated and unvaccinated, partly because just the sheer number of people who are being infected is making a huge difference. Some people ask about breakthrough infections, and it is certainly true that some vaccinated individuals will test positive for COVID-19, and that's called a breakthrough infection. The vast majority of breakthrough infections do not require hospitalization. So while it's possible that someone vaccinated might contract or be infected by the SARS-CoV-2 virus. They may not exhibit anything beyond mild symptoms, if any. Breakthrough infections occur in all vaccine preventable conditions, and they are expected. I have a friend who had the chickenpox and she's had shingles before she's had the shingles vaccine. She still gets shingles. She's one of those people that gets that gets multiple infections. That's not very likely, but and it doesn't happen for most of us. Most of us get a vaccine and we don't get those infections. But for some people who have certain pre-existing conditions, they do get breakthrough infections, and so that's true of COVID. It's true of every other vaccine preventable condition that we have encountered so far. So one of the things that's happening is a lot of people are sharing anecdotes of, oh, I heard about this person, or I know this person, they had the vaccine and they still got an infection. Why should I get the vaccine? The reasons to get the vaccine are those graphs that I was just showing you. It's that what the vaccine is doing is that it's preventing most cases of COVID, and it is preventing most serious repercussions of COVID. And that's the outcome that is to be expected for the vaccines. It's not going to be prevent every single infection. It's not going to be absolutely 100%, going to do that, because that doesn't happen. We don't, but it's doing a really, really huge job. That's important. So before I move on to risk, there are questions about vaccines, Jim?
So we did have a question about the tests. Is it possible for a COVID test to mistake a common cold or a flu virus as COVID?
Oh, that's an interesting question. No, it doesn't do that. It doesn't work that way, because what the COVID test is looking for is it's looking for very specific markers on on an infected cell. So there's certain proteins. So our whole body, most of our cells have, they're little lots of different proteins. So what there's the proteins, a couple of different ones that these tests are looking for. And they have to do in most cases with the spike protein, the thing that makes the coronavirus look the way it does. It has those little spiky things on the outside. And so most of the tests are looking for a specific protein that's only there in a coronavirus and and specific for the COVID-19 virus or infection. So you're not going to get cross-contamination with other kinds of infections. And that's why if you go to the doctor and you are sick and exhibiting symptoms, they might give you both a COVID test and a flu test, for example. Just like a couple of years ago that, or whenever that you go in for a sore throat and they might give you both a throat swab for strep throat as well as a flu test. It's looking for two different markers of two different kinds of infections.
That's it for right now, Dr. Franssen. Thanks.
Okay, thanks, Jim. Your COVID-19 risk, every individual has a very personal risk. And the reason why sometimes it can be very confusing to understand the different guidelines and the different information that you're getting from different sources is that public health officials and doctors and scientists are all coming together to try to make generalizations, to try to say, well, most people fit this model. But there's a lot of individual risks that exist in any disease or public health issue or anything like that. So your COVID risks are going to have to do with things that have to do with your own personal health, as well as the environments that you spend time in. So a couple of different groups have been looking at trying to better understand how each individual can understand their own personal risk. So for example, there are a couple of different individual risk estimators. So these are interactive websites. This is one that exists. And what you do is you go in and you fill out some information about your age, your gender, your race, ethnicity, your health status, things about you that might put you at a higher or lower risk of contracting COVID if you become exposed to it, or having worse outcomes if you become exposed to it. So for example, someone who is older, and say 75 or older, somebody who is maybe has diabetes, hypertension, some of those kinds of things, that's going to increase the risk factor so that if someone becomes infected, they are more likely to have a negative consequence from it. And even someone who is vaccinated and boosted may be more likely to contract the disease if they have a large number of the risk factors. So that's what you're looking at with an individual risk estimator. Other risk calculators, like this one that was developed by a group at Harvard in their School of Public Health, what this risk calculator is doing is it's working to understand what the transmission risk is in a given environment. So for this one, if you go on to this calculator, what it does is it asks questions about the cleanliness of the environment. How frequently is it cleaned? What kind of disinfectants are used? What is the airflow and the air filtration system in the environment? Different things, how close in proximity are you to how many people? Things like that to better understand the environment. And it does not take into account who you are. It's taking into account what the environment is. Your individual risk is going to be a combination of those things. And so best understanding how to navigate your world and your personal risk is going to take into account all of those different things. And one of the things that humans are not terribly good at is having good, accurate risk assessment. So trying to juggle all of those different factors all of the time, it's a very effortful thought process, and it takes us a lot of time and attention. And it leads to a lot of confusion because we have conversations with people who they're worried about an individual risk factor, like having a predisposition to diabetes or hypertension, like I was saying. And then someone else is worried about the risk factors of how clean the environment is that they're working in. And both of those things are important, but they're important in different ways, and they're gonna cause different effects on increasing your risk. And so those risk calculations are pretty challenging to do. And it's going to lead to a lot of confusion because everyone's talking about the things that are important to them. So those are just some pieces there that are food for thought as we are moving into this next couple of phases, which is understanding Omicron. I promise I'll come right back to this, but I wanted to skip over here and think just a little bit about the decision making that is done at these large levels. In public health, what public health practitioners are doing, and those are the people that are trained to work within public health. There are master's degree programs, there are medical programs, Ph.D. programs, people who have spent a lot of time trying to understand how to bring together the different aspects, the research on a given health topic, the public health resources that a community or state or region or country has, the political preferences of a community, of of a larger group, what the actions are that can happen, the health issues, the local contexts, what a group has, putting all those things together to be able to make decisions. And then, that's a bigger, more complex set of decision making than I think most of us do on a regular basis. We sort of think, oh, well, I'm going to take this information and make this decision. And, why can't we have better decisions? Well, because we're trying to put together a whole lot of people and make decisions. And those models of certainty and the complex interactions that we're getting in public health practice and, and in the research that's done, all of that's sort of constantly changing and changing the guidance. Because that guidance is changing so regularly, then it leads all of us to be a little confused and concerned. So it's very, very understandable for all of us to have anxiety and to not understand the things that are changing rapidly. That doesn't mean that things are being done without thought. They're being done with a great deal of thought. It's just not always incredibly easy to understand what's happening. So before I stop for some more questions on decision making and risk calculations and so forth, I did want to kind of leave us with where we are with Omicron. These are some data from I think the data was collected by the World Health Organization and then shared on Our World in Data, which does some really great graphics and compilations of data that's out there, looking at several different countries. And the big news is that most of us feel that we're on the other side of the peak of Omicron. It has peaked and should be declining, and we hope that that's true. If we look down here, though, at South Africa, which was the first area to experience Omicron, the declining peak is a much slower. It's a slower decline than it was an increase. So even though caseloads went up super fast, they're going down much slower, and they are still not at pre-Omicron levels. And so there's a big question right now as to how long it will take to get past this Omicron surge, and what will life look like. I think there's a great deal of hope that in another month or two, that will be on the other side of Omicron, and we may be closer to understanding what COVID might look like in an endemic situation as opposed to pandemic situation. It's too early to know exactly if that's where we will be, but there's a great deal of hope that those are the conversations that we can start having in a couple of months as we move to the other side of this Omicron surge. So this is a tough time of the pandemic, and there's a lot of hard things that people are dealing with at this moment. And one of the hardest things is that there's all this really effortful thought that has to go into how we're living our lives, and we're exhausted from 2 years of dealing with it. And that's incredibly difficult to do. And the biggest thing that we need to do as a group is to watch out for each other, to continue putting our community at the forefront of our thoughts, and to work together to get out of this and be together on that. So those are a couple of my final thoughts, but I will be happy to answer questions for the next 10 minutes or however long we have left in the hour. So Jim, hit me with it.
Okay, Dr. Franssen. So we did have a couple questions. So in different indoor environments, like say, if you're in the airport or on a flight or you're dining in a restaurant, what's the best way to keep yourself safe?
The best way to keep yourself safe is to layer up all of your levels. So of protection, you're going to want to keep your mask on need to keep distance from others that are not part of your immediate party. Practice good personal hygiene, like, hand washing and hand sanitation. And keeping as much airflow as possible. So for example, now's not a great time to be in a small crowded restaurant or bar taking off your mask and breathing in the same air as other people who are taking off their mask and doing that. That's and it's hard because it's winter, so it's chilly, so it's hard to be in those more well ventilated spaces. Those tend to be a lot colder, but finding spaces, if you're going to be taking off the mask for some period of time, finding a way to do that in a high airflow situation is going to be much better. So those are a few things to do. But yeah, if you're going to be someplace like on an airplane or whatever, stay masked, stay kind of on your, like, in your own little, like, personal bubble of physical space and your airspace.
Okay, so the more airflow, the better, essentially.
Yes, definitely. The more airflow, the better. And actually, there's a couple of studies done on the airplane itself. They have a really they have good filtration of the vents in airplanes, but airports, where you tend to be like kind of crowded in around people, can actually be a higher transmission area for traveling. So thinking about, if you're traveling and around people, how can you keep yourself a little bit distant from others during those kind of situations?
Okay, so we've talked indoor environments. So what about outdoor environments? If you're outdoors, do you still need to be concerned about social distancing and that sort of thing?
Yeah, that's a great question. In an outdoor environment, then it's particularly right now, because Omicron is so highly transmissible and it takes less of those particulates to invade your system. It's a very good idea to either mask or keep social distance, or do a combination of those things to try to just kind of keep a little bit more distance between yourself and others, and to consider masking, particularly if you're outdoors and you're having trouble maintaining that distance. That's when a mask is a great idea. If you feel like you're going to be passing within close proximity to a lot of people, then go ahead and put a mask on in an outdoor environment. But if you're outdoors, like taking a walk around your neighborhood and not really like interacting with a lot of people, then the mask isn't required. Of course, it's so cold right now that the mask is actually like a huge benefit. Keep your nose warm.
Okay, so we did have a question. If you get COVID once, can you get it again?
Yes, you can get it again. Part of the reason for that is that viruses are just like that, and you can get infected with the same virus multiple times. The other thing is that the variants are changing. So, for example, if you had been infected with the Delta variant, you can still potentially get infected with the Omicron variant. There's some new research that's showing that those who have been infected with the Omicron variant might be less susceptible to infection by the Delta variant. So it might actually help with that, but the vaccine helps with all of them. So that's not a good reason to like go get infected with Omicron, because first of all, you don't know which variant that you might get, and second of all, it's not 100%. It's not a for sure protection. These are the kinds of things that we'll know a lot more of a few months down the road, once more testing, we've had time to do more testing. So right now the answer is yes. Once you can be reinfected. I think that the guidance is that if you've been infected within a couple months, then you may not be as susceptible. And I think that's because they're postulating it's the same variant, and so you may not be as likely to be infected with the same variant. I don't know if that all makes total sense, but the idea is, the summary is, yes, you can be reinfected. And so definitely try not to, even if you've had COVID, still use all of the protective mechanisms that you can.
All right. Thanks so much, Dr. Franssen. So we're going to have to bring it to a close for today. Thank you all for joining us. Thank you, Dr. Catherine Franssen, for helping us discover more about our world. So please join us on Wednesday, February 2nd at noon for A New Eye in the Sky, the James Webb Space Telescope. And that will be presented by Justin Bartle. He is our immersive experience manager here at Science Museum. If you have caught an astronomy show in the Dome, you have most likely heard Justin's voice. You'll actually have a chance to see him if you register for this presentation. You can register for that at smv.org. Each talk is free to attend. It is open to the first 300 registrants. Thank you for joining us again. And till next week, stay safe and stay curious. Thanks for being here.